Wow, what an inspirational talk from Sharon. Wasn't that amazing? What a tough act to follow, Sharon, really honest to God. I was sitting there going, how am I going to, go after Sharon? Sharon and I both received awards from the AVMA back in 2008 for animal welfare, Humane Award. And we haven't seen each other since. And I'm such an admirer of the work that she's done in Oregon and working with the veterinary community, which can be a challenge. And I almost feel like I want to throw my speech out, because what Sharon has done is really given us the heart and soul of what we need to be doing, which is a culture change. It's a mind shift. And for me, when I arrived at the ASPCA back in 1977, and I don't usually admit that, but it's been quite a while, there was no such thing as shelter medicine. And we really were just warehousing animals and killing them. And so to speak to, what Sharon has, presented to you in the keynote is that note of hope. Because when I arrived at the ASPCA, 80% of those animals got euthanized. And I never dreamt that with a culture shift and with some inspired leadership and really challenging these long-held notions, that we've now moved from an agency that had a $6 million budget to one that has over $150 million budget. Okay, and that we went from begging for money, well, we still ask for money, but we also give away millions of dollars to help shelters around the country. And so it says to all of us here that it can be done. It's not a dream that's unattainable. It means we just have to put not only our hearts and our souls, but our science to it. And unfortunately, the science is kind of boring, but that's the part that I'm going to tackle this morning, which is getting to zero through disease management, through disease control. And one of the key points that I want to make about that is that it's not just about disease control. We can work as veterinarians and veterinary professionals, students, technicians, nurses, to keep the animals alive. We can defeat disease. It's not easy, but it can be done. But that doesn't get them a home. So it really has to be a collaborative effort. And I want to focus a lot on animal health and well-being, because so often the veterinary community focuses on disease control. And that's how we're trained. We're trained to look at physical health. We're outside of our comfort zone when we start talking about behavioral health. So I want to challenge us to recognize that effective disease control requires a focus on welfare and quality of life. And in order for you to deal with quality of life, you have to understand behavior. And you may not know this, but at least in the States, not every veterinary college teaches animal behavior. So it's very difficult to determine what's outside of the normal behavior for an animal if you don't know what normal is. So we're now shifting a lot of our work as veterinarians to a focus on physical and behavioral health, which includes stress reduction. We talk about environmental enrichment, and speaking to Sharon's point, where it's no longer appropriate to put a cat in a 2x2 cage and think that you've done that animal a service. And cats have just received such a disservice from our shelters, and we're looking at a whole paradigm shift on that. The way to save animal lives is not to bring them into the shelter. We're looking at the importance of environmental enrichment and saying that we have to provide animals with the things that they need to exhibit those normal behaviors. We talk about having toys, perches, that when animals are stressed, they want to hide. We need to give them hiding places. And certainly when I got started, and we would talk to the behavior folks, and they would say, oh, you need to give them a place to hide. As a disease management expert, we'd say, oh, no, we want to be able to see the animals. We don't want them to hide. When I'm doing rounds, I need to see, are they sneezing, are they coughing, or do they have discharges? I don't want them to hide. And not recognizing that by stressing that animal further, we're making that animal more susceptible to disease. And so it really has required us to do a shift on that. And I can tell you, I was on the committee with the task force that worked on the ASV guidelines for shelter standards of care. And it was a massive research project, and we looked at guidelines from around the world, looking at New Zealand and Australia, and seeing what was out there for us, and then trying to sort of mine all of that information to make recommendations for shelters. And the recommendations that we came up were not based on your budget, your mission, your goals, or anything. It was based on what animals need and looking at the 5 freedoms. And so saying that, yes, it's important that they have exercise and playtime, that they're socialized, and that we focus on alleviating distress and suffering rather than just on vaccinations and dewormings and isolation and quarantine procedures. But the principle in shelter medicine is to keep healthy animals from getting sick rather than getting sick animals healthy again. And that's certainly not the approach that I learned when I went to Cornell's veterinary school. And when I graduated from Cornell and couldn't figure out what my next career move would be, I was asked to go work at the shelter, and I thought, oh my God, I don't want to work at a shelter. I had visited the shelter when I was a student, and I thought it was the most depressing, awful place that I'd ever seen, and that I hoped I'd never ended up working at a shelter. And so when I graduated and somebody said, would you come work at the shelter? I said, I don't think so. But then when I thought about it, I said, here's an opportunity to really give value to these homeless animal lives, because somehow when an animal has an owner, it has value. Goes in the shelter and has no owner, has no value. It gets adopted, it has value again. And my sense was that these animals have value throughout their lives. It's not dependent on whether they have an owner or not. And so we started looking at what can we do better for these animals instead of having them in colony kennels. And the first thing was looking at, if they come in and they're healthy, isn't it a tragedy that they get sick on our watch and they get euthanized? So we really need to focus on, when they come in well, let's keep them well, and let's make sure that they don't get sick, because in a lot of shelters, if an animal even sneezes, that can be a death sentence. And I'm so thrilled that for so many shelters that has changed, but not enough. Okay, there we go. So what I want to also focus on is that when we're designing these healthcare programs, so often when I got started, I kind of thought I was in it by myself, and that if we got an outbreak of upper respiratory or a parvo or something, somehow I did something wrong. Right? I didn't have the right cleaning protocols. I didn't have the right vaccination guidelines in place. I wasn't examining enough animals quickly enough, and sort of realizing that we can't do this by ourselves. You know, it's not just the veterinary team that's responsible for keeping the animals healthy. It's the shelter staff, it's the volunteers, it's the public as they walk through, and advising them how they in fact can be a part of disease transmission. And so how are we going to work so that we can involve them in keeping animals healthy? So I'm going to try to hone in on a few of the key elements of this shelter healthcare program, and I'd like to tell you that this is going to be kind of a tour, but it's going to be more like a dash, because I have so much to tell you, and there's just not enough time. I'm going to try and focus a little bit on some key points about managing population density, about appropriate husbandry, which focuses on having the proper design of the shelter. It doesn't have to be an expensive shelter, as Sharon pointed out. It just needs to be designed so that the animals' needs are being foremost and being met. Good sanitation, minimizing stress, and then we'll talk about the actual veterinary health care plan, but that's probably the piece that you can access most readily. At some of the other points that I'm going to stress that you might think, well, why is she talking about that? Why is she talking about nutrition? Isn't that common sense? Doesn't everybody know that? But almost everything in this presentation is a result of a question that appeared on the Shelter Vet listserv, of questions that we've received at the ASPCA. It's amazing what people will email you and ask you about. I just remember being frustrated when somebody would email me and say, well, I put some flea spray on my cat 2 days ago, and the cat's convulsing and trembling. What should I do? And I get that email 2 days later, you know, and wonder why on earth would you use an email process for something that's immediately identified as an emergency? So let's start out with minimization of crowding. That's got to be one of the key goals of any healthcare program. And certainly it's obvious to us that less direct contact between animals is going to result in less disease being immediately spread through direct contact and less fighting. But it also reduces the stress on the animals and on the staff, which then allows us to have more time to give appropriate care. And Sharon kind of touched on capacity for care, and recognizing that every shelter has a capacity for care, and every shelter needs to identify what that is, and maybe adopt some of those strategies where you may be an open admission shelter, and you feel that you're compelled to take in every animal, but if it's going to exceed your capacity for care, then you may be doing that animal a disservice by bringing it in. So what is population management? Well, it's an active process of planning, it's ongoing evaluation, and response to changing conditions, because the goal is to reduce the length of stay of animals in our shelters. And all of us that worked in shelters knew intuitively that the longer an animal stays in a shelter, the more likely it is to get sick. But because we're such scientists and we have to have data, we've actually got studies that prove that to us, and that allows us to press on with this case about reducing the length of stay. And recognizing that our capacity to provide care is not just based on the number of cages. So often the shelter says, well, I have 100 cages, that's my capacity. But we have to look at the number and condition of the animals that are admitted. If they're all healthy, you can probably provide better care than if they come in and they're sick and they need individual treatment and processing. You look at the size and the condition of the facility, we look at the staffing and the training, and again, recognizing it's not just our number of primary enclosures. And we've actually gone to some shelters and looked at their programs and said, you can actually increase your live release rate if you reduce your population numbers. And that may seem kind of counterintuitive, but we've shown, over and over again with shelters that we've worked with, that, again, a lot of the research that's come out of the ASPCA is that you can adopt more animals by having less of them. It's like going into the supermarket and being overwhelmed by 500 choices of ice cream and maybe walking out without any because you can't decide. But if you've only got 15 choices, it's less of a challenge. And we're actually working on data to encourage shelters to actually believe that. And when we exceed our capacity for care, we often see that animals are going to be suffering. So here's a staffing formula that comes from the National Animal Control Association and the Humane Society, and it estimates that it requires a minimum of about 15 minutes to clean and a cage and feed the animals, and that's based on 9 minutes for cleaning, 6 minutes for feeding, and it assumes that you're just going to take 3 hours to do that. You don't want animals sitting in their excrement for the entire day, because that's how long it takes you to clean the cage. And then the rest of the time is spent on animal care, laundry, socialization, so on and so forth. So if you want to use this formula and just work through this with me, what you're going to do is look at the number of animals you have in the shelter every day and multiply that by 15 minutes. And that's going to give you the number of minutes that you need. All right, and then when you divide that by 60, it tells you the number of hours that you need. Okay. Going further along with that, divide by 3, and that's going to tell you how many staff you need per day. So here's an example. If you've got 200 animals in your shelter, you multiply that by 15, you're going to get 3,000 minutes. You're going to divide that by 60, you're going to get 50 hours. So that's 50 hours of animal care. Divide that by 3, you should have a staff of 17. Think about your shelters and how do you stack up? You have 200 animals, do you have 17 staff members to provide animal care? Now, you might not agree with this formula, and I would challenge you to come up with your own formula. Time your staff and see how long does it take for them to provide just minimal care of feeding and cleaning, and recognizing in a shelter that it takes more than that to manage a disease control. Some of those animals have to be taken to the vet's office. We're going to utilize our volunteers to hopefully do some dog walking. We're going to have the socialization going on. We've got lots of other programs that are going on. There's the laundry that has to be completed, so on. Lots of tasks that go into running a shelter program. So, work this out for yourselves, but again, acknowledge what your capacity for care is and do your best not to exceed that. So if we move on to talking about the well-designed shelter, a lot of us are in shelters that were built, that were not built for animal care. And so we have to look at what are the shortcomings in those shelters and how can we best improve the conditions, and look at what are the ways that we can make changes that are going to impact animal health. So we have to look at the ventilation in the shelter. We have to look at foot traffic patterns. How, when people are walking through the shelter and serving as fomites, which are inanimate objects that transmit disease, how are they walking through your shelter? Are they starting in the healthy areas and going to the disease areas first? Do they have total access to the shelter? Say they're looking for a lost animal, and what if they go through the entire building, they go into your isolation ward where you have sick animals, and then decide, well, you know what, I can't find my dog, I've been looking for a week, I think I'll go adopt a puppy now. Are you gonna let them go directly from your isolation area with sick animals into your puppy ward? And how do you manage that in a customer service friendly way so that people aren't insulted? We have to look at the types of materials that were used in some of our older shelters that have wood that we can't disinfect. How are we going to retrofit those areas and move animals out of there? Or do we have isolation and quarantine and treatment areas available for the animals if we do in fact get a disease outbreak? How easy is it to disinfect the area? What are our sanitation protocols? And I'll talk about that at some length in a few minutes. What are the types of housing we have, noise levels? So much goes into looking at design of a shelter, and certainly most veterinarians are not trained to look at this. And we tell shelters now, if you're fortunate enough to be able to build a new shelter, that you need to take the time to look at some other shelters and not make some of the mistakes that we so often see. And working with architects and contractors who are familiar with shelters, not just veterinary hospitals, because very different missions and goals and types of materials that need to be used. So one of our focuses, and when we talk about animal health, is about ventilation. That's Animal Health 101 in vet school. And we've have this mantra about your HVAC system has to have 10 to 20 air exchanges per hour as the ideal setting. But, you know, that's the beauty of research, where we're starting to find out that that's not necessarily the case any longer. We used to believe that all of our respiratory diseases were aerosolized and sort of floating through the air, and so that meant that you had to have this incredibly expensive air exchange system to deal with that. But now we know that a lot of the respiratory diseases that are spread between cats are by droplets. They're not these little tiny aerosolized particles. And so if you've got to economize, that you want to have the better HVAC system in your dog areas. And recognizing that if the disease is going to be transmitted by fomites on our hands and our clothing, then we have to beef that up, particularly in our cat areas. You know, when we were working on the ASV guidelines, we struggled a lot with whether we needed to put a temperature range in there, because we acknowledge that what's appropriate for a husky or a Malamute is certainly not going to be appropriate for a Chihuahua. So we kind of toyed with, we could just say that if humans are comfortable, then the animals are likely to be comfortable. But we know that that's not always true either. So in researching the veterinary literature, we sort of came up with 15 to 26 degrees centigrade. But that's a range. And recognize that when you are examining your animals and doing rounds through the building, that if you see animals that are shivering, that they need to be moved, that we have to respond, and respond quickly to these situations where animals are outside of their comfort zone. You know, having access to natural and ultraviolet light is important. If your HVAC system is not great, we've seen shelters run out and buy fans, but you've got to use those with caution. You don't want them blowing directly on the animals. We get a lot of questions about HEPA filters and saying that they're going to be helpful in creating a more healthy environment, but they're not going to remove the disease, the viruses and the bacteria that are most likely to be causing diseases in our shelters. And so we don't want you going out and investing in, you know, portable units. They really need to be commercial units, and recognize that that's not a replacement for appropriate ventilation. We need to have physically separate isolation areas in our shelters. And whether you're treating or not, if you're holding animals and you suspect that they may have disease, there needs to be a place to separate those animals from the general population. And so, ideally speaking, when you're designing a shelter, it would be best to have several small areas that you can then adapt to what you need. So I've seen shelters that were designed where they have one huge area, which is a disaster when it comes to disease outbreaks, and it's also a disaster when it comes to noise. And so having several smaller areas that you can convert to isolation is going to be the ideal shelter design. And then if you need to do a quarantine, if you need to isolate, if you get in animals that are being transported from another location, which we do so frequently in the United States, you have a place where you can quarantine those animals for several days. And you want to be able to minimize the movement of sick animals within the facility. So rather than having an isolation ward that gets filled up and you have sick animals spread out throughout your building, you want to be able to take another area and create additional isolation. And so one of the key principles that we try to promote with shelter design is being able to have versatility. So when we start looking at primary enclosures, I remember when I got started at the ASPCA, almost everything was in a colony kennel. And then we started moving everything into stainless steel cages. And back when I got started, most of the animals were there for a short-term stay unless they were legal cases or cruelty cases. But now, as shelters have a variety of lengths of stay, we recognize that we also have to have a variety of types of cages. And so, or enclosures, pens, colony, or runs, so on and so forth. And rather than coming up with a specific set of dimensions for canine housing, we felt that it was appropriate in the guidelines to say that the animal should be able to stand up, lie down. When it lies down, head and feet should not be touching the parts of the cage. They should be able to take a few steps and distance themselves when eating or sleeping from their excrement. And how many of you have enclosures for your dogs where you'd say that it meets these guidelines? You know, one of the things that we recognized when we created the ASV guidelines was that shelters might be threatened by the guidelines, but we say rather than be threatened by them, we say to use them as sort of a yardstick to measure how are we doing and what could we be doing better, what should we be doing better. We're not holding animals for a day or two. We don't have that model where an animal would walk in the door and a day later be walked down to the euthanasia room. So when we start thinking about how we're changing our whole mindset about disease management and holding animals, that we have to think about enrichment. That cats need litter boxes that their entire body can fit into. I've seen these little tiny litter boxes where the cat can't even get it can just barely get its front feet into the litter box. So they should be, size appropriate litter boxes. They need perches, they need hiding places, and they should have 2 feet between their food, their litter box, and their resting area. And that's going to mean that a lot of us have to go back and look at how we're housing our dogs and our cats, and recognizing that as we try to provide better for their welfare, we've got to make some major changes in some of the structures. And they have to have readily accessible, food and water dishes. And again, you wonder, well, that's obvious, but I've seen cases where the water bowl was attached to the cage and there was a kitten in the cage and the kitten couldn't possibly get up to get to the water dish. So these are all important considerations. So if we move on to talk about stress, all shelters are inherently stressful. At the ASPCA, we spend an incredible amount of time with our behaviorists in redesigning our facility, where we have tons and tons of volunteers who come in to do enrichment. The animals get walked on a daily schedule. We have playtime, socialization. We play music, you name it. But that doesn't change the fact that those animals are stressed because you've changed their environment, you've changed their diet, you've changed their routine. So we have to continually work on this. And this is not the fluffy piece that you do after everything else. And that's, to us, was also a culture shift, because that just falls to the behavior staff. They come in and they do that. And saying, no, everybody who works in the shelter needs to pay attention to the fact that everything that they do creates stress for that animal. If you're taking that animal out of its cage to take it to the vet's office or to take it for a walk, how are you going to do that to minimize that animal's stress? What are the things that we do on a daily basis, like slamming the cage door after we clean the cage? And think about that. You've got a stainless steel cage, you've taken the animal out, you've disinfected the cage, you put him back in the cage, and bang, you slam the door. And that animal is sitting in that room and has to hear that a dozen times each time you clean out another cage. So it's really training the staff to be mindful of how the things that they do create stress in the animals. Let's see if I can't go back here. And key point, which you'll hear me, sort of go over and over again, is about overcrowding and how that creates stress, and that results in more disease. It does not result in more lives being saved. And so here's one shelter's attempt. Imagine being called to this shelter and being told, we've got an outbreak of upper respiratory infection here, what can we do? And the first thing we're going to say is you've got to reduce the population, you've got to get them into proper housing. These are animals that are just under major stress. You know, they can't hide, they're sneezing, you know, on each other. And their notion is that by holding more animals, we're going to save more lives. They're just going to have more sick animals here and more animal suffering. So you move to the colony kennel, which is a little bit better, but we still got overcrowding. Okay, so we've really got to pay attention to reducing the animal population and managing the population appropriately. So here's some considerations to reduce stress through housing. We look at colony housing for compatible animals, and we do a lot of that now. We're recognizing that dogs are social animals, and we see a lot less stress when we can co-house dogs, and sometimes it's just 2 dogs in a kennel or a run. We see less barking, we see less anxiety, we see better behavior. You're keeping our litter mates and housemates together, separating the 4-month-old and juvenile animals from the adults. And I've seen that in our own colony kennel where we put kittens and adults together, and typically that's not what happens, but occasionally the things fall through the cracks, and you see the kittens want to play, and the adult cats are just saying, please just leave me alone. And how stressful is that for the kitten who can't get, you know, any activity, and how stressful is that for the adult cat that just doesn't want to be bothered? So we really look at that. We look at bullies and aggressive animals and saying, if you're doing colony kenneling, you still have to have a place for, you know, individual cats, because not all cats want to be in a colony. And there's been at least one study that showed that when you put cats in a colony, it increases their stress rather than decreases it. So then you get the bully cat who sits in front of the food dish in the colony and doesn't let any other cat approach it. And you've got to have people that sit and watch the colony. You know, it's not something that you're just going to see in a minute or two, but just having volunteers watch and make sure that that's not happening. And I was in the shelter for a brief visit and was just watching the cats, and I just watched this one cat that wouldn't let anybody else approach the food dish, and he finally moved away. And so when one cat finally decided it was safe to approach the dish, that cat got up and got between the cat and the food dish. That's a cat that needs to be housed separately. And that's a real quality of life issue. We need to have shelves and hiding places for all cats. We find that dogs like to get up on platforms too, and so that would be helpful. We need to separate our dogs from our cats, and predators from prey. That was one of the things that I learned early on is at the ASPCA. We used to always put our rabbits in with the cats. You know, because, you know, rabbits are just like little cats, right? And just think about the stress on the cat who's looking at the rabbit thinking, wow, would I like to get, you know, to that rabbit, and the rabbit who's fearful for its life. And so recognizing that we're not always aware of these things and that we have to be mindful of what we're doing to our companions when we make these decisions that really kind of ignore the science. And then we have to have housing for animals that are feral animals that don't like to be handled, so we try to get them into quiet areas that are not very heavily trafficked. Ideally speaking, we wouldn't be bringing ferals into our shelters any longer. And we have a huge cat initiative, which is looking at how we've not done well by cats, that, you know, shelters are virtually a death trap for a lot of cats. And so wouldn't it be better to not bring them into the shelters at all? And we're going to be talking about that later on in the conference when we talk about management of free-roaming cats. But for now, when you do bring the ferals in, they need to have a space where they're not going to be handled, where there's not a lot of traffic. We look at housing for dangerous dogs and say we like to have them in a 2-sided cage with a guillotine door so that we can still clean and disinfect those enclosures without handling the animal. And for animals that are simply fearful and distressed, where can we put them with staff who might have a little bit better training for managing their special needs? And again, someplace that's going to be quiet and not heavily trafficked. When we look at management considerations, as I said, it's like I'm going to be like a broken record. Avoid overcrowding. Make sure that the staff is trained to handle animals properly, and that's ongoing training. So often in our shelters, we bring in new staff, and we allow them to be trained by older staff and don't really monitor how they're being trained. And animal handling, I mean, we always stress that the minimal amount of handling that's necessary to get the job done is what we want to use. And yet in shelters where we may be understaffed and we may be busy, sometimes we lose sight of what's appropriate handling. We like to see a routine set for daily procedures, and using the same staff, because animals are less stressed when they have a routine. And again, this is one of those principles that we all sort of know, but when people call in sick or people are on vacation and the routine gets thrown out the window, and that dog develops diarrhea or some other signs of distress, we're not sure now whether is this actual disease or is this stress-induced disease. So we really need to pay attention to that. One of the key things that came out of some of our veterinary research was the idea about how we clean cat enclosures. And we came from that school of thought that said every day the cat enclosure has to be cleaned and disinfected. So we go through this massive effort to take every cat out of its cage, regardless of whether it was healthy or sick or lactating or pregnant, and we clean that cage out, we disinfect it, and put the cat back in. And what we discovered is that inducement of stress can create a recrudescence of the herpes virus that causes respiratory disease. And what's so ironic about that is that animal may come into your shelter and be healthy. You take it out of its cage, you keep cleaning the cage, disinfecting the cage. A week later, that cat starts to sneeze and show respiratory signs. And now you don't know, did that animal pick up the disease in the shelter? Or is that simply an old herpes virus infection that has now resurfaced due to stress? And those animals can sneeze a week after they're stressed, and they can sneeze for a week, and then they can go back to normal. But if you're in a shelter where sneezing could represent a death sentence, we've done that animal a disservice. And when we look at our environmental considerations, we start talking about maintaining appropriate environmental conditions, making sure that we don't have wild temperature fluctuations. One of the problems that we encountered at our facility was we had very high ceilings, and in order to keep the air conditioning comfortable for the animals, it had to be cranked up all the way. And that meant that the staff got cold. And so the staff would constantly go and change the thermostat so they would be comfortable, until finally we put a lock on the thermostat and said, the shelter is being kept at an appropriate temperature so that the animals are comfortable, and not, we want to be humane to the staff, but you can go put a sweater on. You're just here for an 8-hour shift, whereas the animal is there all day long. I talked a little bit about minimizing loud noises. Here's one. Does everybody turn the lights off at night? I was surprised when I first started talking about that, and staff said, well, if they had staff on all night, and a lot of shelters don't do that, but if they did, they left the lights on all night. We said the animals need to sleep, and they need to get into a deep sleep, which means that we need to turn the lights off. Little simple things like that. Some shelters are using pheromones like Feel Away and DAP, and we've got mixed results from some of the studies that we've done on whether or not this actually calms animals down. But for those of you who are using it, can I get a show of hands? How many people are using Feel Away? Okay, and how many of you think that it really makes a difference, that it helps, it calms the animals down? Because some of the data says yes, some of the data says no. How many of you don't think it's made any difference? Okay, so, that's not exactly a scientific study, but it's pretty much a reflection of what we've seen. Focusing on enrichment, having toys, access to windows, access to natural light, bedding, perches, platforms for comfort, hiding places, so on and so forth. An interesting note about toys, I've gone to a lot of shelters, and everybody has like a little toy drive, and all the animals have toys in the cage, and we sort of feel like now we've provided enrichment. How many of you see the animals actually playing with the toys? So is it something that just makes us feel better, but not necessarily the animals? So we want to look for effective enrichment and not just something that we read about in a book and said every animal should have a toy. When it comes to nutrition, I want to just say a couple of words about that. And it was interesting when we were writing the first editing. I like to always say that. When we talk about, we did the first shelter medicine textbook, I take comfort in saying that we edited the book. So if you don't like it, we didn't write it. We just edited it. If you love it, then, well, we edited it, but we try to have it go both ways. But we kind of struggled with each chapter that we put in the book, and I said, do we really need a nutrition chapter? I mean, isn't that kind of, we just know that this is how you feed animals. And then we got so many inquiries over the years, not just on our shelter vet listserv, but that just came to us through email. And I think the most telling example that I got was a letter from a shelter who said, Dr. Miller, could you please write a letter to our shelter manager, because we're going through budget cuts right now, and they've decided that every dog is going to get a cup of dry food, whether it's a Chihuahua or a Great Dane. Okay, so we just need something in writing to say that that's not appropriate. So we thought, yeah, we need a nutrition chapter. There were questions about whether or not you can feed expired food, what the quality of food is. And we tend to take shortcuts when we've got budget cuts going. And even the early days of the ASPCA, I remember we were going through a budget crisis. We went through many of those, which is one of the reasons why we eventually relinquished the contract for animal control. And one of the shelter managers said that, we've got this euthanasia list of animals that we're going to euthanize in the morning. So we're not going to give them dinner because they're going to be killed in the morning anyway. And, the veterinary staff said, you can cut down on the number of paper clips you buy or a number of pencils you buy, but you are not going to not feed these animals. So that's why I'm saying it was important to talk about nutrition and saying that every animal should get an individualized diet plan. So you're not going to feed the obese cat the same thing that you're going to feed the cat that is, oh gosh, I have 10 minutes and about 50 minutes left to talk about. But that's why I said this is not a tour, this is a dash. That you want to be sure that every animal has an individualized diet prepared. It means you have to have a variety of foods available. Again, when I got started, you just go buy a giant bag of Purina dog chow, and that's what you fed. So now we're talking about you have to have diets for growth, diets for obesity, recovery diets for animals that need the extra nourishment, so on and so forth. That the food should be stored safely so that it's not contaminated, and that they have to have fresh water available at all times unless it's medically contraindicated. And again, that was a response to a shelter that called and said that, sometimes the animals overturned the water dishes and the staff got tired of refilling them, so they were just going to give them water 3 times a day. And we said that's not appropriate in a humane shelter. They have to have access at all times. So I'm not going to talk much about behavior, but I want to make this key point that was an eye-opener for me from Dr. Frank McMillan, who's probably the foremost veterinary expert in the United States on quality of life. And he makes the point that emotional suffering can cause more physical pain than illness or injury, and he gives multiple examples of that. And so what we looked at when we did the ASV guidelines was raising the importance of behavioral health to the same level as physical health. So initially we had them combined as physical and behavioral health as one big section, and we said no, because we didn't want the behavioral health piece to get hidden or receive less importance than the physical health. So certainly signs of stress and maladjustment should be treated as seriously as physical illness. And recognizing some of the signs of distress, which could be changes in vocalization, they're not eating, they're spinning, they're pacing, they may be feigned sleep, they may be hypervigilant, so on and so forth. And staff needs to be trained to recognize this and deal with it. So, and the intervention is going to be very simple. And this is a slide that I borrowed from Sandra Newberry that shows a kitten that's distressed, and here's a simple solution. Wasn't very expensive, Those are the types of things that we have to have on board in our sort of toolkit for disease management. Okay, so quickly, sanitation. It's a critical piece to disease control. We've got to do cleaning and we've got to do disinfection. Whenever there's a disease outbreak, one of the first steps should be to look at your sanitation procedures, know what you're trying to kill, and know what kills it. Okay, we've talked a little bit or touched on the fact that one of the most common means of disease spread in shelters is through fomites or inanimate objects, our hands, our clothing, transport cages, and volunteers, staff, and the public can all be responsible for spreading disease. So in order to disrupt fomite transmission, we really need to focus on sanitizing everything. And one of the key things that we need to do is wash our hands properly. So often you dip your hands under the water and you do a quick, 2-second scrub and you're done. Well, the CDC website, Centers for Disease Control, has a whole protocol for hand washing, types of products that are appropriate to use. We should be wearing gloves. And the hand sanitizers, we used to think were not such a great idea. If your hands are soiled, you still need to wash them. But in the absence of having the ability to wash your hands, the hand sanitizers are a great aid to use. Just the key point that I want to make out of this slide is we want to try to minimize disrupting the animal's life when we're doing our cleaning, and that instead of cleaning and disinfecting every day for every animal, we need to clean daily, but disinfect only when a new occupant arrives. Okay, so we want to minimize the movement of our animals through our shelter, and sometimes the animals come into intake, and then they go to a holding place, and then they go to adoptions, and then they go to spay-neuter, and then they go to recovery, and then they're moving all over the place. We really want to minimize the movement, and when we do that, it's not necessary to disinfect on a daily basis. This is a list of some of the most common shelter disinfectants. The ones that we feel are most effective are going to be sodium hypochlorite, the potassium peroxymonosulfate, and our newer product, the accelerated hydrogen peroxide, or ACEL. And whichever you have access to, you need to know what the strengths and weaknesses are of these products and use them to the best effect. And I do want to say this, there's a lot of controversy about this, but we've got at least 4 university studies that tell us that the quaternary ammonium products do not kill parvo. The parvo manufacturers, the quaternary ammonium manufacturers will tell you that they do, and we're just waiting for some independent studies to corroborate that. But until we see that, it's our best advice is that if you've got a parvo outbreak and you're using a quat, that you should switch to the sodium hypochlorite, the trifectant, or a product like ACEL. And these 2 newer products, WYSIWASH and Brew Clean, are not been used as extensively in shelters as some of the other products, but they're certainly products to watch. I've talked about that. I want to just zip right through the veterinary healthcare program. Obviously, I think, but I've got 5 minutes left. Well, I'm going to talk at 20-minute speed for 5 minutes. But these are the key components. Examine the animals when they get there. Okay, isolate and treat sick animals as soon as you can. We don't quarantine animals routinely. We use them for appropriate situations. And I did provide some of this information in your notes because I knew that there wouldn't be enough time in 45 minutes to cover all of this. Appropriate vaccinations, so on and so forth. Let's just look at a couple of those in depth. We know about disease transmission. You have to have a thorough understanding of all of these things about every disease that you have to deal with in your shelters. You want to know what the incubation period is. You want to know how long the pathogen is shed from the animal's body. You need to know how is it transmitted. You need to know, is there a carrier state? How can I kill it? Is there a vaccine that's going to prevent it? How long does it live in the environment? So on and so forth. So if we look at that for parvo, we know the incubation period can extend as long as 14 days. Now that's not the conventional veterinary literature. It's going to tell you 4 to 6 days. But in shelters, we do have some anecdotal evidence that it may take as long as 14 days. You need to know that if you're going to quarantine for it. It sheds for 3 to 12 days after the animal's infected. There's no true carrier state, but it is transmitted through feces, fomites, rodents, insects, direct contact. You need to know what the signs are. The key thing about parvo is that it's difficult to kill. It can live in the environment for a year or longer. Okay, so that's what makes parvo such a challenge to deal with, and I'm going to talk about that tomorrow morning. Examine these animals when they get to the building, because you want to identify infectious disease, you want to identify animals that need immediate medical care. You want to make sure that the description of the animal is accurate if you're doing lost and found, and if you're involved with cruelty investigations, you need to have that information as soon as the animal gets there. We want to get animals into isolation as soon as we think that they may have infectious disease, and we want to make sure that we have isolation for respiratory disease, for ringworm, for different diseases. You don't want to lump everybody that's sick into one ward. And make your decisions. If you're going to treat them, initiate treatment right away. If you're going to relocate them to a hospital, do that right away. Or if you're going to euthanize, it's better to do it sooner rather than later after that animal has suffered. Medical rounds. How many of you have medical rounds in your shelter? If you're going to try to reduce the length of stay of animals, you need to do rounds, okay? They should be performed preferably twice a day, but at least once a day. You visually examine every animal for its demeanor, for vomit, for diarrhea, to see if it's ambulating, so on and so forth. Get a picture of that animal's overall health status, okay? And get staff to help you. With vaccinations, there's no one vaccination protocol that's going to work in every shelter. The key thing about vaccination is to recognize that it doesn't work by itself. Every animal that's vaccinated is not going to respond. Okay, so some animals are not going to be successfully immunized. And so there are a variety of host and vaccine factors that may contribute to that, but it's still an excellent tool to use, particularly with distemper and parvo outbreaks, because those vaccines work very quickly and they prevent infection. Vaccinate on entry to the shelter, vaccinate as many animals as possible. We're looking for herd immunity. So you might think, well, if the vaccine doesn't work for 3 days and I'm only going to keep the animal for 2 or whatever your rationale is, again, it's not just for the individual animal, it's for that herd immunity. Use a modified live vaccine that's going to work faster and last longer. And recognize that we vaccinate in shelters every 2 weeks. The vaccine manufacturers may tell you every 3 to 4 weeks. But because we have more disease exposure in our shelters, we feel we need to take that extra step. So with dogs, we're vaccinating against distemper, hepatitis, parainfluenza, and parvo. Those are our core vaccines in our shelters. You may have other diseases that are endemic in the area. For example, in the States, it may be leptospirosis. But in the shelters, these are the diseases that we're vaccinating for, and every 2 weeks. With cats, it's rhinotracheitis, caleci, and panleukopenia. Again, every 2 weeks until they're 18 to 20 weeks of age. And that's a little bit longer than we do it in private practice. In private practice, we typically may only go to 4 months. Again, because the exposure is greater in shelters, we vaccinate further out. We recommend routine deworming of every animal. How badly am I doing on time now? Just getting to my 0 point? Okay. 3 minutes into the question period. Okay. I really tried, guys, but I had to respond to Sharon's talk this morning, and I knew that was going to put me off schedule. Deworming routinely for roundworms and hookworms, even though your primary problem may be something like coccidia or giardia, what we're concerned about is zoonotic visceral larval migrants and ocular larval migrants. So we've got to make sure that we're deworming appropriately and following the Centers for Disease Control or the Companion Animal Parasite Council's recommendations, which is immediately every 2 weeks until they're 3 months of age, once a month from 3 to 6 months, and then perform surveillance as needed. With disease testing, I just want to encourage folks, if you're looking at your budget and you're saying, I really can't afford to disease test, you need to do it. Okay, because it's going to save animal lives. It's going to help you develop better treatments. It's going to identify the pathogens so that you can come up with a better prognosis. You'll know what's going to kill it, and you just don't want to be using the shotgun approach and hoping that somehow you're going to break the back of a disease outbreak that way. We talk about routine screening for leukemia, FIV. Typically, we don't recommend that because the incidence of those diseases is fairly low in our populations, but certainly if they're adopted, you want to encourage the adopters to do it. The other diseases are just too difficult for screening, but I wanted to make a point of saying that because some shelters think, well, we'll just screen everything for parvo, and that's not going to be an effective way to do it. With outbreak management, do a risk assessment, utilizing both disease and titer testing, and recognizing that if you get an outbreak and the typical response is to euthanize everything that's exposed, having a plan is going to result in less unnecessary euthanasia. So we want to combine disease testing with titer testing to see if they've got protection, and recognize that your animals most at risk are your young, exposed, unvaccinated animals, and adult vaccinated animals are going to be at the lowest risk of developing disease. Foster care, you guys know about that, I think. How many of you have foster care programs in your shelter? Okay, beautiful. I'm not going to talk about that other than to say it's great, and if you don't have a program, you need to get one. And just finally, about euthanasia, I think Sharon touched on this. It may be the most effective disease control method, but it's often unnecessary if you have a plan in place. And that's what we're looking at, getting to zero and not having to use euthanasia as a disease control plan or as a population management plan. So recognize also that it should be considered in certain circumstances. So I'm not saying this is when you do it, but I'm saying this should be on your list of options. It's part of your toolkit. And basically, if animals are suffering, and you can't do anything about that. You can't get them into a veterinary hospital. You can't get them in the foster care, and you have no other options. I think one of our primary responsibilities to these animals is to make sure that they don't suffer. So getting to zero will take time. It takes resources. It takes planning. It's not impossible. There's no single healthcare protocol that's going to work for everybody. We need to look at the needs of the entire population as well as the individual animal when making these care decisions, and so often we don't do that. But again, I want to emphasize that preventing and alleviating animal suffering should be one of the most important goals that we have in trying to get to zero euthanasia. So. These are just resources, the shelter medicine textbooks, infectious disease management. There's 2 first and second edition of shelter medicine. The UC Davis website, sheltermedicine.com, has excellent resources on it. ASPCA Pro, Shelter Vet is the website of the Association of Shelter Veterinarians. University of Florida has an excellent shelter medicine program going, and Maddie's fund has an infection control manual that is also an excellent resource. I apologize for going over my time, but as I said, it was just an amazing amount of information to try to convey. Thank you.